Most men can improve their fertility, although it is generally held that if a man is infertile, he really needs to go to a fertility unit so that his wife can be treated. In fact, most men, by taking fairly simple lifestyle measures, can improve their fertility. I think we certainly should. Once we have identified that indeed a man does have a low sperm count, by doing more than one sperm analysis, because of course there is great biological variation, day to day, week to week, month to month, and even seasonally. Once we have established that they've got a low sperm count, it is very important to look at the whole man and to attempt to make, as we do elsewhere in medicine, a diagnosis. Because, of course, without a diagnosis, then treatment isn't possible, and perhaps of equal importance, without a diagnosis, we will make no progress. So a low sperm count does usually represent some condition, although we may not understand all of those conditions, but some conditions which in many cases is important and does require, therefore, investigation and treatment. If we stand back from this biologically, then of course a low sperm count in the animal kingdom, an infertile or subfertile state, is often the first sign of some other condition. And once again, as we may not understand, and I certainly don't pretend to understand all the causes of an apparently normal man having a low sperm count, I think it is absolutely incumbent upon us to make that important attempt at diagnosis which may lead to treatment. Yes, we certainly should, because we do know that 50% of the problem, that is a failure to conceive, may well be due to the male factor. And so whenever we have a suggestion that the sperm count is subnormal, after 3 analyses, we should do some further tests, and nowadays we can look at the DNA quality of the sperm that may be a clue to why a man with an apparently normal semen analysis has not actually been responsible for a pregnancy. I think there is increasing evidence that that statement is true. It used to be thought that male factors only accounted for 30% of men's infertility or couples' infertility, but in fact we're now, and it isn't surprising, beginning to realize that it is an equally shared problem. We should certainly be investigating all these men very thoroughly. There is increasing evidence that there are a range of conditions which previously were thought not to be relevant. First of all, we must ensure that the environment for sperm production is appropriate, that it's not too hot. There are lifestyle features that may cause the sperm to be too warm because the man's riding his bicycle in a competitive way down the embankment into work every day. But he may also have a varicocele, a collection of veins in the scrotum which warm the testicle and also therefore produce sperm of less good quality. Other lifestyle features are important. We're realizing the importance of an antioxidant-rich diet, and nutritionists can be extremely helpful in this regard. We're also increasingly realizing the importance of microorganisms. These are germs which cause no symptoms, cause no long-term illnesses or effects, but may be damaging the quality of the sperm on its way between the testicle and the prostate gland. So there's quite a lot that we should be looking at. And perhaps one of the most important recent innovations is the ability to be able to measure the quality of the DNA in the sperm. This is known as a DNA fragmentation test. It is becoming more popular, and I think it will prove to be extremely useful in defining some conditions which previously we've always referred to as unexplained infertility.